John and Ann, the IU Public Policy Institute found that opioid-involved deaths are sometimes double what's reported. They say better tracking will lead to better treatment and fewer deaths.
When a Hoosier dies from drugs, it's not always made clear on the death certificate exactly what killed them. Sometimes people who had fentanyl in their systems aren't counted as opioid deaths, just an overdose. The Marion County coroner saw that as a huge problem.
We identified that, there was also heroin and fentanyl in these overdose deaths as well. It's just that on the death certificate, it didn't say heroin or fentanyl or whatever drug was in the system. It just simply said multiple drug overdose.
It's like saying someone died of cancer but not disclosing which cancer they had. IU researcher Brad Ray has been digging into the numbers. He says Marion County and likely all of Indiana has been grossly undercounting its opioid deaths.
So about 80% of the deaths that we code as unspecified had an opioid present in them. If we called those opioid-involved deaths, which we should, we would have a much higher number of opioid overdose deaths in Marion County and our state.
How much higher? Sometimes more than double. For example, in Marion County in 2011, instead of 50 opioid deaths, it's actually 110. The numbers are way off at a time when Indiana is desperately trying to save lives.
We're putting a lot of money towards this, a lot of energy, and if we don't have good baseline data, we won't know. Right? If anything we're doing is having an impact.
It's why IU is working to change the system and accurately track the numbers. In late spring, we'll all be able to access online real-time data on Marion County's opioid deaths. How many are dying? What are they using? Is there a spike in a certain type of drug?
It's a health crisis.
The Marion County coroner made changes, too. They're now putting specifics on death certificates and encouraging other coroners to do the same. And they're applying for a federal grant to help pay for better toxicology testing, better forensic training.
But we've got to start with those numbers so that we can show this is an issue. This is causing people to die.
Now, another issue in getting good data is how labs do the toxicology tests on someone. The basic screen checks for hundreds of drugs, but not fentanyl, which is a little surprising. Coroners actually have to pay most labs for a second test to see if the person had that in their system, and not all coroners do.
Okay, so that's an issue. How much does all this testing cost?
Yeah, well, a basic screen runs $145 to $185. Again, that does not test for fentanyl. It's another $100 to test for fentanyl. You multiply that by the nearly 400 estimated deaths in Marion County just last year. It's expensive.
Yeah, you wouldn't think that money should be an issue in this, but you can't get away from money being an issue.
It is.
All right. Thank you, Jenny.